Hey, welcome to Chapter 20. We are going to do the genitourinary system. With this system here, we are going to look at infections that we have in the urinary tract. So we're going to be looking at UTIs, what usually infections we get for the lower urinary tract, ones again for the upper urinary tract, the pyelonephritis. We're also going to make sure that you code the infection, the organism. So again, there's no subterm for E. coli under the main term cystitis. Therefore, codes 930.90 and B9620 are assigned for cystitis due to E. coli. So your urinary tract infections, keep in mind those are like your N codes. They develop following surgery, and it's not really a postoperative infection. So usually, again, you may want to ask the physician whether the infection is related to the procedure. Okay, so if it's related to a implant or graft device, it's going to be a T code for like complication, mechanical complication, that type of thing. Okay, so we get into, we've already had hematuria. Okay, we talked about this before in the blood. And just remember, we can have gross, microscopic. Gross, again, keep in mind this is with the human with a naked eye. Where microscopic, they can only see the blood if they look under the microscope. Urinary incontinence. This can be a stress continence, and it can be for female or male. In men, usually it's because of prostate surgery. Urge incontinence is an intense urge to urinate following by loss of urine, could be an overactive bladder. So just look at the urinary issue, make sure you go to the right area, make sure male or female, that's always important. Some of them don't distinguish between the two, and if they don't, then you just code it, as stated. Okay, we also have renal disease, and we're going to talk a little bit about that. So with renal disease, you're going to see nephropathy, okay, infection of the kidney. You can have chronic kidney disease. And again, here's what you want to really look for. If we have chronic kidney disease, we're going to look at the basis of severity. So one thing to remember is when we're looking at these, you have the different stages, and usually your documentation should tell you what stage. I've had students ready at the advanced level. We look at the creatinine levels, and usually it kind of tells you if it's one level that it's going to be this stage. Okay, so then we have end-stage renal disease, which again is progression of CKD. And at this point, it's a regular dialysis session for the kidney transplant, before a kidney transplant, I should say, to maintain life. We have a Z code, which is dependence on renal dialysis. And we have codes N18.6, Z99.2 for stage 5, CKD, when it does require chronic renal dialysis. All right, so then there's codes for kidney transplant. Acute renal failure, again, N17, and chronic or acute. Renal insufficiency versus failure, okay? These pretty much are used, again, interchangeably. If you look here, we have acute renal failure, N17. Insufficiency could be N28, kidney failure, N19, unspecified. And a lot of times, like I said, you may have to query the physician for these. Okay, kidney disease with hypertension. Remember, going back to the circulatory system, we have codes from categories 112, 113, which require additional codes that we need the stage of the CKD. All right, so I'm not going to go through that again because you can go back and review the circulatory. We also have kidney disease with diabetes. And then here we have our E code. Our last digits are going to, again, give us more information on that. Okay, so renal dialysis. With that, we have our Z codes. peritoneal. Again, make sure that when you go to code these procedures, it's usually going to be, this is creation here, but with this, it's going to be an O code. Here we have irrigation of the peritoneal cavity. So again, otherwise it could be revision. Hemodialysis, all right, we're looking at the section, which is going to be the extracorporeal systemic assistance, the body system. Our root's going to be performance. Okay. How long? Duration, continuity. We have 6 hours per day, 6 to 18 hours per day, or is it more than 18? Okay, so the same thing with hemodialysis. Look through your book. It gives you a nice step-by-step play on hemodialysis. A lot of good examples, so make sure you utilize your textbook. I really, really do like this textbook. It has good information in it. I'm always referring back to this textbook. All right. So coding examples, we have, let's just kind of go through here. Patient with end-stage renal disease admitted for insertion of a totally implantable portacath. So it's anchored in the chest, the catheter tipped in the right atrium. So here we have our end code for the end-stage renal disease. Okay. We have, let's go ahead, Z99.2. Okay, and that's going to be dependent on the machine. Procedure, the first one is 0JH60WZ. So that will be just to give you an idea. Okay, insertion, keep that in mind, and then it was open. And we are going to go to vascular, and then Z. Okay. All right, so complications. It could take 2 to 3 months because they could get an AV fistula to mature. So those are different complications with dialysis. And keep in mind, these are diagnosis codes. Okay, so how do I look these up? You could go to complications, mechanical, anything in this area that's going to come up with your T code. Okay, cystoscopy versus as operative approach. A cystoscopy is used as an approach for many procedures performed in diagnosing and treating urinary tract conditions. No separate code is assigned for the approach. Your ICD-10 says that the approach is via natural or artificial. Your transurethral procedure should be coded to the approach. Okay, so again, this is usually a natural or artificial opening. Okay, so keep that in mind. You want to know if it's done to visually or manually explore the bladder and no other procedures performed, you just want to code it to the root operation inspection. Okay, and then we have the ESWL for removing a calculus. With that, it's going to be the root operation fragmentation. This is a common procedure. We also have lithotripsies where we treat larger bladder stones. This could be extirpation. Okay, so again, come back here and review some of these. We have prostate disease, which again, we talked about that a lot in the neoplasm section. All right, prostatectomies. Again, remember, whether the complete prostate was removed, then it's resection. If only a portion, then it's going to be excision. So it all depends. All right, endometriosis. This chapter does cover a wide array. Okay, then we have a genital prolapse. Okay, so here it's in the vagina, ureterovagina. Again, you need to know what part we're at in the anatomy. Okay, so again, a lot of these codes here are just explaining things out. Hysterectomy, the biggest thing here is for the hysterectomy. Why are they doing it? Cancer, endometriosis. We need to know the type when we do the procedure. Again, with that, taking the uterus, what are they all taken out? Total. And then the last part is diseases of the breast. So yes, this section really covers a lot. We even have radical and modified radical mastectomies. So with this, again, when we have a radical mastectomy, keep in mind when they're saying radical, that means they're just taking more tissue around the breast. Okay, breast reconstruction, we have codes for that. We have codes for everything. So this wraps up this unit. If you have any questions, let me know. Again, it's all about anatomy. It's all about finding that correct spot and make sure you go far enough in your book.